Welcome Friday Focus, October 21st, 2016. Last week we talked about getting our planes off the ground on time, which is our Delta Airlines equivalent of getting patients into production, giving same-day treatment. And we know that if we don't do same-day treatment in every aspect of our practice, we can't grow. We can't give the brand promise that we promise to our patients. And we tell them we're going to give them excellent service, try to respect their time, get great results, but that can't occur unless we give them the service. And if we don't do same-day services, the probability of them doing the service drops off precipitously. Okay, so if you say, well, we'll take that mole off next week, probably they're going to go somewhere else, someplace to accommodate them. And almost like telling people that you're going to schedule them for what they want done, it's kind of equivalent to saying, we don't really consider your problem that much of an issue. We'll get to it when it's convenient for us. So we always got to focus on having enough manpower, scheduling properly, organizing our time efficiently, and managing ourselves in such a way that we can do same-day treatments. Now, certainly, there's times when manpower are being stressed, so that might work on smarter scheduling. We've added about 60 people to our team in the past 6 or 8 months, so certainly we have manpower, maybe some training issues we still got to work on. So that's an opportunity for you to grow your team by making a bunch of A players and really strong players. But what about existing patients? They're coming back in for the Botox or filler, they're getting their dermatology rechecked, they're coming back in a few years later with some concerns about veins in the other leg. And what about existing patients that are going through treatments with us? They're getting their hormones done regularly, they're in the process of vein treatments, or in the process of a dermatology treatment, getting their Botox every 3 or 4 months. What is the opportunity for us to really give them better service? And we have a lot of opportunities. And keeping in mind that if you don't offer them what we have to offer, we can't deliver a brand promise. It's not possible. And that's what's important about brand promise. We promise it. So you have an existing patient, and there is the opportunity to talk to them about other services we offer. We talked recently about talking about men and women HRT. We know that if we get the women who are perimenopausal or middle age on hormone replacement, will cut the risk of breast cancer by more than 50%, cut the risk of a fatal heart attack by over 50% in their life. Men, we know we can reduce their risk of heart disease and heart attacks by over 50%, increase their energy, decrease obesity if they have low testosterone. We have some people that, particularly at Shelby location, that maybe we can offer a dermatology screen. I think it'd be really important that we should acknowledge that nobody should be coming to our practice regularly for Botox and then get a cancer discovered somewhere else, right? We should offer them a cancer screen. And what I want to do is get the PAs and the dermatologists working with everybody so you at least kind of recognize abnormal skin conditions. So if you're putting a stocking on somebody's leg, you realize, I don't know what that is, but you probably should have it looked at. It doesn't look normal. So we're going to put some education things together. Not that you're doing the screening, but you should, if you're doing somebody's treatment, you see a skin lesion that looks suspicious, you should know what a suspicious one is. And we talk about vein screenings. So we have an opportunity for an HRT patient or a derm patient to, let's take a look at your leg veins. Your insurance gives you a benefit of getting your veins covered. Let's see if you have vein disease. We can offer the best service better than anybody else in our community, so we should offer it. So we have cross services. Then we have cosmetic products, topical products, and I think that's something that we're actually doing less now. We've added a lot of staff, so people maybe aren't as experienced or don't understand the need for topical products, but our business is up substantially. Products are kind of down. Some people are doing a fantastic job talking to their patients about it, and some people just really are kind of forgetting. And we have a lot of people investing a lot of money into their face and into their skin. They're spending $4,000 or $6,000 on a magic lift. They're getting lasers done, Fraxel done. They're getting dermatology checks. What are we doing for them to protect their investment? Okay, are we talking to them about proper skin care? We're talking about using a vitamin C in the morning, a vitamin A at night, a retinol at night, glycolic moisturizer, condition-specific products. Or are we saying, go on your own and find something at the drugstore that you're not familiar with, where there's no expert, that we can't measure, you're on your own. Tell them they're on your own. So imagine the person you don't offer products to, you're telling them, I'm withholding information for you, and I think you should go figure it out on your own. We have a team of experts here. So products. And every patient we should have an analysis. Let me talk to you about your cosmetic skin products. Offer them to do a Visia potentially if you have in your office. If not, have somebody look at their skin. In some offices, you don't really have an esthetician. So that's where some frontline medical assistants can get a better handle on this and learn some of the basics of product sales. And then over time, you'll get estheticians. And then after products, what's the next point of things that we're holding back from our patients? Again, these are things we're currently holding back from our existing patients. Tuesday we had about 400 patients through our office. Did we tell all 400 people about these other services? Did we tell all 400 people about, we have products here? Did we tell all 400 people, we want you back? We'd like you to come back. Rebook. If you don't rebook the patient, it's kind of equivalent to saying, we don't like you. If you decide you really want this bad enough, there's really an effort, you can, give us a call, and, maybe we'll take care of you. I'll tell you a story. I've told it before. Some of the staff, it happened to me personally. I had gone to lens crafters to get new glasses made, nice glasses. And the ophthalmologist, I think her name is Dr. Hamavzi or something, really nice lady. She goes, we have this thing for $75 and it'll map your retina and tell you if you have any retinal disease. And I thought, it's not a bad idea. So she said it's actually better than the glaucoma test because it tells us what your eye looks like. So I did a little glaucoma test where they puff that thing in your eye. I hate it. That's just like gross. But I did that. And then they have you stare into this box and you're looking at a little, like a barn or something like that. It takes a picture of your retina. And she goes, this thing's pretty normal, but there's an abnormality where the cup to disc, it's the optic nerve to disc ratio, is not normal. And it could be not normal like buck teeth where it's just, something you have. Or it could be not normal because you have glaucoma and the puffer is not picking it up. You need to see an ophthalmologist. Like that, I definitely don't want to get glaucoma. So I go see the ophthalmologist, Dr. Brian Mazie. I would consider him a friend. I've known him since he was a resident. He was a great guy. And now he's in practice in New Baltimore. That's where I send patients to. And he says, well, Chip, I think we should check you for glaucoma. I'm going to do a special test in this screen. Now, if the test is negative and the pressures are negative, doesn't matter what that picture showed, you don't have glaucoma. But if one of them is positive, we got to treat you because the way you'll find out for sure if you have glaucoma is when you go permanently blind. Okay, so permanent blindness, yes, you had it. So we like to find it before then and treat it. Like, sounds pretty scary. So I got the treatment, I got the test done, unfortunately it was negative. So I go back in and see him. He goes, it was negative, but since you have this abnormal ratio, we should check this every year because the puffer test might not be accurate for you. So I'd like to see you back here in about a year. We'll do the test again. And again, if you don't do this, you'll only know once you go blind. That's pretty important. So he finishes up. He's on an electronic thing. He's clicking away at it, and then he goes to see another patient. So I walk to the front desk. You know what this lady said to me? So Dr. Mazie wants to see you back here in a year to do that test. So you want to give us a call or what? I'm like, are you freaking kidding me? He said you could go blind. Why would you give me the choice? That is like disgusting that you'd give me the choice. Well, she wasn't in the room, and she didn't have the discussion. If she had heard the doctor say, you will only know that you have glaucoma if you go blind, so I want you to get this test to check for it, she would have said, I'm going to make this as easy as possible for you. Put you on the schedule. A week beforehand, I'm going to send you a text message. I'll send you a letter 2 weeks beforehand. Do not forget next year, okay? And so I made her give me an appointment. I said, no, I definitely want to schedule it right now. And okay, and she got it done. But it almost seemed like I was putting her out by, my schedule. I would have forgotten it. I know I would like to get my teeth cleaned every 6 months, but my dentist does the same thing. He cleans my teeth. I'll see you back in 6 months. I go to the front desk. His wife's working there. She goes, okay, give us a call in 6 months. Like, okay, I forgot, right? And I didn't put it in my schedule. If you do not rebook them, you're like the ophthalmologist receptionist telling the patient, well, if you go blind, give us a call, or if you really, really want this test done, give us a call, or maybe if you really, do it on your own. Please, on your own, put it in your calendar and figure it out on your own. Just rebook the patient. Okay, if it's a dermatology patient, we book them in a year for the skin test, for the skin check. If it's a HRT patient, you need to put a pellet in, rebook them in 3 months. They're going to need another pellet. You don't want her to get cancer, give her another pellet. If you're doing Botox or filler, you don't get all those damn wrinkles back, rebook them. Okay, if it's a cool scalp patient, you finish their 2 treatments, rebook them in a month to see how they're doing. They might want additional areas done. They're already happy, they want more areas done. Vein patients, we want them to come back in 2 and 6 months to make sure that they get long-term success. Rebook them. Okay, but if you don't rebook them, if you do not put them on the schedule, the probability of it happening drops. Now, when you do rebook people, there's a possibility that something changes and they have to change it. But if you don't schedule them, you increase the probability that you will not deliver their services. Okay, rebook the patient. So existing patient, cross services, products, rebook. And the last one is events. I did a men's health event Wednesday night. It went fantastic. In reality, every man in our practice should have had the opportunity to have gone to this event and to understand the options they have to reduce their chance of a heart attack by 50%, reduce the chance of diabetes by 70%. Every man in our practice should have had that opportunity, at least have heard about it. But how many really did? Okay, how many guys came through here and were told, you know, we have a seminar going on Wednesday night, and Dr. Moak's going to talk about men's health, something very critically important. You know, we had a lot of guys show up, a bunch of doctors came. It was fun, but we really could do it all the time. If we have a mommy makeover next week in Livonia. We have other events going on. Does everybody in our practice, all 400 that came through Tuesday, did they know about our events? Because if you don't tell them, they probably aren't going to know. You know, we email them, we do all these different marketing things, but what guarantees the fact that they will know, what guarantees it, is that you tell them. Okay, so if a vein patient is here for their ablation, and you say, in January we have a stem cell seminar, and next week we have the XYZ seminar, now they knew about it. Okay, if you're relying on marketing to send them an email, you know, a lot of people don't open their email, it comes with a lot of other things. But if you tell them about it, it guarantees that they know about it, or at least have heard about it. If you don't tell them about it, it reduces those odds by probably by a factor of like 90%. Okay, and these are things that we're kind of right now holding back on our patients, and it kind of limits our ability to give them our brand promise. Cross marketing, do we tell them about the other things that we're offering? These aren't sales, you're just telling them what else we have. Are you talking about their products? Are you telling them, we'd like you to go figure this out on your own, or not even maintain your investment? Are we rebooking them, or are we telling them, you know, just wait till you go blind and give us a call? And are we telling them about our events, or figuring that they should figure it out on their own? That's today's Friday Focus. We have so much opportunity. You know, I was reading a book recently. It was kind of a fun book. And the guy talked about ideas and execution. And it went something like this. So this is an idea. My idea is that we should offer this, you know, to everybody. And the only way it'll get executed is if you do it. Okay? It's impossible for me to do it. You know, I see very few patients relative to the patients here. You've got to do this. You might be at the front desk. You might be in billing, you might be on the call center, you might be an operator, you might be an interactive patient, you might be a technician, esthetician, the PA. Anybody can do this, and everybody can do this, okay? So if everybody tells them we have an event coming up, like let's say the hormone event for men, if everybody they encounter told them about it, and the guy's like 50 years old, you might be thinking, you know what? I probably should go to this. Guy's heard it from 5 ladies telling me that there's this opportunity. And this is something we give for free. We feed them, liquor them up a little bit. So let's talk about ideas and then execution. Make it a math problem. Let's say there's ideas that are bad, so-so, good, and great. So that's ideas. And execution, let's say execution is bad, so-so, good, and great. Now let's assign each one, let's say a dollar value. Let's say a bad idea is worth about $1, and bad execution is worth $1. Let's say so-so idea is worth $10, and so-so execution is worth $10. Let's say good execution is worth $100, and good idea is worth $100, and good execution is worth $100. Let's say great execution is worth $1,000. Great idea is worth $1,000. Great execution worth $1,000. Now you can imagine the math. A bad idea with great execution is like a $1,000 idea, and a $1,000 execution. It really wasn't that bad of an idea, but a bad idea with no execution is worth $1. A so-so idea with so-so execution would be worth $100, but a so-so idea with great execution is $10,000. A great good idea with $100 with a so-so execution is worth $1,000, but that same good idea, if it's executed well, it's worth $100,000. And a great idea worth $1,000 with great execution is worth $1 million. But let's go back. A great idea with maybe this existing patient. In fact, I think I'm going to propose that the Friday Focus that I give to you are either good or great, most of them. Okay, probably not of them, you know, some of them maybe are bad, but a lot of them are probably in this range. And then it's up to our team to get us down here. So a great idea with bad execution is worth about $1,000. That means like maybe one person will talk about the seminars. But a great idea with great execution is worth $1 million. That means that the team talks about the seminars, talks about the different services that we offer. Everybody's thinking about rebooking the patient, or not relying on the front desk to rebook, or the rebooking person. Even the technician and the PA are both saying, we'll see you back here in 3 months for your Botox. Let's get you on the schedule. Like Dr. Maisie told me, I'll see you back in 3 months. So he had a great idea, but it was kind of a bad execution. His front desk person said, well, give us a call in a year. Obviously, I want to be down there. So that's Friday Focus. Thank you very much.